Chest physiotherapy significantly contributes to increased lung function by promoting better airflow and enhancing lung capacity. Patients often experience improved and more comfortable breathing as a result. The techniques employed in chest physiotherapy are specifically designed to remove mucus from the airways effectively. This is especially beneficial for individuals suffering from conditions such as cystic fibrosis, chronic bronchitis, and bronchiectasis. Chest physiotherapy techniques facilitate superior oxygen exchange in the lungs, which is crucial for patients with compromised respiratory function. Percussion and vibration involve manual techniques that dislodge mucus from the airways through rhythmic clapping and gentle vibrations, respectively. These therapies often work synergistically with postural drainage, a method that utilizes gravity to facilitate mucus movement, and assisted coughing techniques, which enhance the efficacy of coughing in patients with compromised cough reflexes. The integration of these techniques is crucial in a comprehensive respiratory physiotherapy program and can lead to improved lung function and reduced hospitalization rates for respiratory-related issues. Factors such as patient age, existing health conditions, and specific respiratory issues can influence the choice of technique and its application, requiring careful tailoring to individual needs to ensure safety and effectiveness. Percussion is a manual therapy technique employed by physical therapists to facilitate mucus clearance in patients suffering from various respiratory conditions, such as cystic fibrosis and chronic obstructive pulmonary disease, COPD. This technique involves rhythmic clapping on the patient's chest or back to loosen and mobilize mucus within the airways, making it easier for patients to expel the secretions by coughing. The underlying principle of percussion is relatively straightforward. It aims to manually dislodge secretions from the airways, promoting their movement toward the larger bronchi for easier expectoration. As described by Fraunfelter, percussion generates waves of mechanical energy transmitted to the lungs, assisting in mucus movement up the bronchial tree. The effectiveness of percussion is often enhanced when combined with gravity, allowing gravitational forces to work in conjunction with the percussion technique to optimize mucus clearance. Percussion is particularly beneficial for patients exhibiting increased sputum production or thick secretions. By clearing excessive mucus from the airways, this technique can improve breathing efficiency, reduce the risk of respiratory complications, and enhance overall lung function. Percussion is typically used alongside other therapeutic techniques, such as postural drainage and vibration, to maximize treatment efficacy. Considerations, precautions, and contraindications of percussion. Before performing percussion, several factors must be considered, including the patient's age, comorbidities, and overall oxygen status, as well as the potential benefits and adverse effects of the treatment. Hemoptysis. Percussion may exacerbate bleeding depending on the cause of the hemoptysis. Acute pleuritic pain. Percussion could increase discomfort in patients experiencing pleuritic pain. Unstable cardiovascular status. Caution is required if the patient has cardiovascular issues. Other conditions. Other precautions include conditions such as subcutaneous emphysema, fresh burns, open wounds, pulmonary emboli, and bronchospasm. It is crucial that trained healthcare professionals assess these precautions and tailor the percussion technique to the individual needs of each patient, as the force and frequency of percussion must be appropriate to avoid discomfort and ensure effective treatment. Vibration is a therapeutic technique utilized in respiratory physiotherapy aimed at loosening and mobilizing mucus in the lungs, facilitating easier airway clearance. This technique involves applying gentle rhythmic vibrations to the chest or back, which helps break up thick mucus and improve lung function. It is particularly beneficial for individuals with conditions characterized by excessive mucus production, such as chronic bronchitis, bronchiectasis, and cystic fibrosis. The process of delivering vibration typically involves the caregiver placing their hands on the patient's chest. This may consist of one hand flat against the congested area, while the other hand is positioned on top. During the therapy, the patient is instructed to take a deep breath in, followed by a slow exhalation through pursed lips, while the caregiver vibrates their hands on the congested area of the chest. Vibration can be applied in various positions and can require minimal active participation from the patient, making it accessible for those who may not tolerate more forceful techniques like percussion. Sessions typically last between 15 to 20 minutes depending on the severity of the patient's condition and mucus presence. It is often combined with other airway clearance techniques such as postural drainage or percussion to optimize results. The primary benefit of vibration therapy is its effectiveness in clearing secretions from the lungs, thereby reducing the risk of chest infections. Other advantages include its versatility in application positions, the potential for patients to learn and perform modified techniques at home, and its compatibility with various other secretion clearance methods. Additionally, it can enhance mucociliary transport, promoting the movement of secretions from peripheral lung regions to the central airways for easier expulsion. Shaking, as a technique in respiratory physiotherapy, serves as a complementary approach to enhance the effectiveness of other treatments aimed at clearing airways and improving overall respiratory function. This method leverages the body's natural response to stress and tension, utilizing rhythmic movements to promote relaxation and facilitate mucus clearance in the lungs. The benefits of shaking in respiratory therapy. Shaking therapy is grounded in the understanding that stress and trauma can create tightness in the body akin to a tightly wound knot. This therapeutic practice offers a unique way to shake loose that tension, potentially leading to better outcomes in respiratory health. By engaging in gentle, shaking movements, individuals can shift their focus from overwhelming thoughts to physical sensations, which aids in grounding them in the present moment and reducing anxiety related to breathing difficulties. The rhythmic nature of shaking has been shown to calm the nervous system, decreasing the production of stress hormones and promoting a state of relaxation. This can lead to improved emotional regulation and a greater sense of control over respiratory symptoms. Moreover, shaking can enhance physical well-being by loosening tight muscles, improving circulation, and increasing body awareness, which are all beneficial for respiratory health. Bronchial drainage. Bronchial drainage refers to a set of airway clearance techniques designed to facilitate the removal of mucus and secretions from the lungs. Effective bronchial drainage is crucial for maintaining optimal lung function, particularly in patients with respiratory conditions that lead to mucus accumulation, such as cystic fibrosis, chronic obstructive pulmonary disease, COPD, and bronchiectasis. The techniques employed in bronchial drainage include postural drainage, percussion, vibration, and assisted coughing, each serving a unique role in the management of airway obstruction and improving respiratory function. Postural drainage. Postural drainage is a foundational technique in bronchial drainage therapy. It involves positioning the patient in specific ways to leverage gravity for the movement of mucus from peripheral airways to larger central airways, where it can be coughed out or suctioned. Different body positions target specific lung regions, enhancing mucus clearance. Trendelenburg position. The patient lies flat with their head lower than their feet, helping to drain the upper lobes. Reverse Trendelenburg position. This position raises the head above the feet, aiding drainage of the posterior segments of the upper lobes. Prone position. The patient lies face down, effective for draining the lower lobes. Lateral positions. These involve lying on either side, allowing drainage of the uppermost lung segment. While postural drainage is beneficial for many patients, it is not universally suitable. Conditions such as spinal injuries, recent surgeries, or unstable blood pressure may necessitate modifications or alternative techniques. It should always be conducted under healthcare supervision to mitigate risks and ensure effectiveness. Assisted coughing techniques are critical interventions for patients who exhibit compromised cough function, particularly in those with neuromuscular disorders, spinal cord injuries, and various respiratory illnesses. These techniques aim to enhance mucus clearance from the airways and mitigate respiratory complications, ultimately promoting improved respiratory health. Manual assisted coughing involves the application of external pressure to the chest and abdomen during the expiratory phase of a cough. This technique is typically performed by trained caregivers or healthcare professionals and significantly enhances the force and efficacy of the cough, aiding in the expulsion of mucus from the airways. Manual assisted coughing can be tailored to meet individual patient needs and positions, thus optimizing the results of the intervention. Manual assisted coughing has been shown to be particularly beneficial for individuals with weak coughs, especially those whose peak cough flow is less than 270 Lmin. As such, it is recommended for patients with neuromuscular diseases who struggle to generate adequate cough force independently. The effectiveness of MAC not only contributes to airway clearance but also reduces the risk of respiratory complications associated with poor cough function.